United Nations Children's Fund UNICEF, in collaboration with the civil society Scaling Up Nutrition in Nigeria, is intensifying efforts to tackle the growing burden of malnutrition across the country. The program is gaining momentum as key stakeholders rally to ensure that every Nigerian child has access to adequate nutrition. We have details in Elizabeth Sholami Okweke's report.
Across communities in Nigeria, malnutrition remains a silent but deadly threat. Statistics from the United Nations Children's Fund UNICEF shows that nearly 1 in 3 children under the age of 5 is stunted, while over 1 million suffer from severe acute malnutrition. UNICEF and the civil society Scaling Up Nutrition in Nigeria, CS-SUNN, are scaling up interventions to address the crisis through community engagement, capacity building, and advocacy. The initiative is focusing on prevention and early detection of malnutrition, especially in children and pregnant women.
The country needs to reposition itself in the fight against nutrition. Getting funding from most of our developmental partners is not even the right approach in fighting this. We need to take ownership. We need to take it as our fight.
Last 1 year, we have seen some movement in the right direction by government policy and actions. Most importantly is the fact that governments have recognized the importance of nutrition through advocacy efforts of partners.
With a multi-sectoral approach, the program promotes exclusive breastfeeding, micronutrient supplementation, and improved water and sanitation practices.
We have economic challenges, but the CNF provides an opportunity for us to augment domestic funding to procure commodities in our primary health care centers and in our communities for the sake of our children, and above all, also for the sake of our pregnant women.
Direct push to get government to commit resources into nutrition by making appropriate resources available, moving from 0.016% of the total funding for nutrition which government had provided in the past to targeting close to 30% of that. And that is what we are hoping will be achieved. There is also a push to see that when women are pregnant, they attend antenatal care, get appropriate nutrition information, and they are provided with the micronutrient support using the multiple micronutrient supplements.
In states like Kaduna, Lagos, and Borno, success stories are already emerging as more children receive the nutritional care they need. Stakeholders are calling on state governments to scale up investment and strengthen policies that support sustainable nutrition outcomes.